I had a client come into me over the last couple of weeks because she is getting ready to have a knee replacement, and she had several consults and decided to go with one specific surgeon based on the fact that they do a mostly custom implant for the total knee. This surgeon is a really good dude. I like him. I talk to him off and on. We even have exchanged text messages, like we have each other's phone numbers. Back in 2014, he became part of a larger group that owns their own physical therapy clinics around town. They don't often refer out unless someone is really struggling, or it happens to be a family member, or it is one of the surgeons themselves, and then they don't see their own PTs. Prior to 2014, if you were an orthopedic surgeon or even a family physician and you owned physical therapy services, your reimbursement rate was higher than like me as a physical therapist owning a physical therapy clinic and submitting a bill. But since about 2020, all of the insurance companies have started paying those orthopedic clinics the same amount that they would pay a freestanding physical therapy clinic. I believe part of the reason is that they noticed there was a lot more billing being done under physician NPIs instead of PT NPIs, and they caught wind of what was happening and got tired of paying more than they would normally pay for physical therapy in the state of Colorado. What does all of that mean to this patient that's having surgery with him? He has started saying that all patients who do his surgeries need to have his physical therapy protocol that has an online component where he follows up. It has a vitamin and supplement regimen, and it is no less than 3 months. And of course, they can opt out of this, but it's not encouraged for them to opt out of this. This concierge care that really, it's a fish oil, a high protein supplement, and some micronutrients and greens. It's not, it's $5,000 for the 3 months. So on top of the fact that he wants you to see his physical therapist, who he makes money off of, he then wants you to do this online program that's all pre-written stuff. Like, it's a protocol for post-total knee replacement. It's not even customized to the individual and where they're at. And he wants you to get these supplements. It's $5,000 for 3 months. And he says it includes the follow-up care that's done in his office afterwards, which that follow-up care is at week 2, week 6, and week 12. That follow-up care is no different than the follow-up care he was providing before. So basically, you're getting a couple $100s worth of supplements and an online personal training program that may not be right for you for $5,000. So what I did instead was I taught this woman how to get herself up to eating 120 grams of protein a day with real food and not a supplement. And I taught her what supplements would be great for her to take to get all the micronutrients that she needs, including increasing her vitamin D, and then also where she could get more greens in her diet, because she really doesn't enjoy salad and she eats vegetables, but probably still not enough. She's also getting very personalized. We make adjustments every 3 weeks to her routine. One-on-one care for $197 a month. So now she knows how to eat right. She knows how to get most of her protein from food. She's got supplements that aren't costing her an arm and a leg. And she's getting a custom to her knee replacement workout plan. So for his 3-month program, it would have cost her $5,000. For the 3 months that she'll spend with me, it'll cost her about $800. Which one would you pick?